Alright. What do you want to be when you grow up? This is a very common question to us, especially in youth, and especially in high school. Ever since I was a little kid, I always wanted to have a job in sports medicine. Sports medicine is a medicine that helps athletes recover from injuries. Jobs in this field include sideline doctors, physical therapists, and nutritionists. Obviously, a job in sports medicine didn't really answer the question specifically. As I got older, the thought of which career path I would take grew. I was irritated due to the fact that I couldn't really find a job that involved my interests in life. Then, the answer came to me, or at least expected. In summer 2013, my brother was playing for a soccer team. Jumping up for a ball, he landed horribly and tore his ACL. There he is right there. Now, at the hospital, I got talked to with this doctor that was performing the surgery, Dr. Hussein. There he is. Dr. Hussein is an orthopedic surgeon with 14 years of experience. He has worked with many sports associations like the Angels, WWE, which is World Wrestling Entertainment, and Men Professional Tennis. After hearing how close his job is with the world of sports, I instantly fell in love with the career. So instead of helping my brother recover from injuries like I was supposed to do, I was doing research on my future job. Orthopedic surgery is the branch area that involves the musculoskeletal system. This is one of the most important systems in your body, considering that this allows you to move. Now, orthopedic surgeons handle a lot of injuries and diseases in their line of work. Things like torn ACLs, tumors, and even Alzheimer's disease. Like any other job in the medical field, orthopedic surgeons require a lot of schooling. You first need to receive a bachelor's degree in subjects like chemistry, anatomy, or biology, which takes about 4 years. Next, you must receive a medical degree, which takes about 5 years. And lastly, you need to complete a 5-year residency at a hospital. This step is so you gain hands-on experience with real licensed orthopedic surgeons. So in total, you're looking at about 14 years before you become a licensed orthopedic surgeon. Now, I swear this is true, a year after, in summer 2014, my brother tore his ACL again. Now, I got to talk to his doctor, and he mentioned something very interesting, the evolution of orthopedic surgery, how it began and where it is today. In the 1700s and 1800s, there weren't many orthopedic surgeons around, considering how complicated the musculoskeletal system actually is. But that all changed in World War I, considering how advanced technology was. I want to take a look at this picture. These are some of the tools orthopedic surgeons use to recover and help soldiers. Now I want to take a look at this picture. These are tools used by the late 1900s for orthopedic surgeons. Now, at today and age, that all changed. Now I want to take a look at these two pictures and beware, it's a little gruesome. Both of these people received the exact same surgery, a torn ACL like my brother. But you see a difference, right? One has like at least 15 stitches and the other has like 4. You want to know the secret? It's robotic surgery. Orthopedic surgeons use robotic surgery to do pinpoint, precise cuts that allow them to do the exact same surgery and have the patient with less scarring. Now, on top of all the cool things I get to do with orthopedic surgery, I want a job that would help people. And so I asked myself, how did this job do just that? To answer this question, I looked at a research conducted by USA Today. They conducted research on high school sports and the injuries that are involved with it. 1.35 million students are injured due to high school sports out of 7 million. Now I want you to take a look at the top 2. They're strain and fractures. Both of these types of injuries are handled by orthopedic surgeons. So I concluded, well, at least in my eyes, that orthopedic surgeons allow athletes to get back on their feet if they're injured and chase their dreams once again. Now, my point of this talk is not to persuade you to become an orthopedic surgeon or even join the medical field, considering some don't like the amount of schooling or don't even like the subject at all. My point of this talk is to choose a job in your life that involves your interests. For me, I chose orthopedic surgery because it involved my 3 main interests in life: sports, medicine, and to help others. One of the most successful men that ever lived on this planet, Steve Jobs, wrapped up my point in a very simple, powerful quote. Have the courage to follow your heart and intuition. You somehow know what you truly want to become.